And the Prime Minister has finally laid out a roadmap exit strategy from COVID. As you know, we criticised his failure to do so on this show last week, along with the sloppy mistakes of the Berejiklian government in allowing people transporting infected overseas passengers to remain unvaccinated. To discuss the roadmap, I'm joined by Liberal MP David Sharma and Labor Senator Matt Thistlethwaite, both of you in lockdown. Thanks for joining me. Dave,
thanks, Sharri.
Good to be with you, Sharri.
Should international arrivals of returning Australian citizens be halved? Let's start with that, David Sharma.
Look, I'm not thrilled about it. I don't think the Prime Minister was. I don't think the New South Wales Premier was either. Obviously, a couple of the state premiers, or three of them, in fact, West Australia, Queensland and Victoria, which incidentally have not been taking, the lion's share at all of international arrivals, have asked that this be done because of their concerns about the Delta variant. I think National Cabinet, the way it works, is obviously a consensus-driven organisation because the states have certain responsibilities under our constitution and the federal government does. And so obviously if those views need to be taken into account, but I'm very conscious that it's going to cause significant hardship to a whole number of people, perhaps not as much as it did earlier on in the crisis, because people have had significant opportunities to move and go overseas and come home since then, but it will doubtless cause some heartache, and I'm just hope it can be as short as possible.
Matt Thistlethwaite, it's excellent the Prime Minister has finally announced a roadmap out of lockdown, but the reality is that we're still likely to be in and out of lockdowns as outbreaks occur for potentially the next 9 months or until even past the next federal election.
Yeah, that's right, Sharri. And unfortunately, that's because we don't have enough of our population vaccinated at this point in time to begin relaxing some of the restrictions that we've had to have in place to keep the rate of infection down that we're seeing elsewhere in the world. Unfortunately, while Australia's again in a period of lockdown and there's millions of us who are facing stay-at-home orders, the rest of the world is opening up. And the reason for that is we don't have enough Australians vaccinated. And when you look at that league table produced of the OECD nations, Australia's last. The Prime Minister promised that we'd be first in the queue. We're actually last. And that's the reason why we've still got these restrictions. That's why many businesses, particularly small businesses in my community, Dave's, and across the country, are still suffering because they can't get the restrictions lifted until we get the vaccination numbers up.
Dave, it's impossible to argue with that. We are now behind the rest of the world when it comes to the proportion of our population that's been fully vaccinated. Are you concerned this issue alone could cost the Morrison government, your government, the election?
Well, my concern, Sharri, is to make sure as many Australians as want a vaccine can get it. But I'd make a few points here. Firstly, we weren't the first country to start delivering vaccinations because where that happened first, Israel, United States, the UK, a number of other OECD countries, they did so under an emergency authorisation. That is, they bypassed the normal regulatory health and safeguard approvals process to get these vaccines into people's arms. Why did they do it? For very understandable reasons, because they had people hospitalised and people dying with COVID. We didn't have to do that because we weren't in the same situation. So our program only really began 22nd of March. 21st of February, we started to roll out to sort of healthcare workers, but it only really began for the population at large as at the 22nd of March. And when the Prime Minister announced that, he said at the time he wanted to have, the timeline was that every Australian would have a vaccine, a first dose, by the end of October. I think we're going to come quite close to that. I don't want to bet the house on it because there have been hiccups along the way. Some of them are outside of our control, some of them are within it. But at the moment, we're running at about 1 million doses every 9 days, and that timeline is getting shorter and shorter. We've passed 8 million doses now. So in the next 3 months, I think you'll see a very large share of the Australian adult population who wants a vaccine will have at least had their first dose. And it's important. I think it's critical to opening up. But I'd just say one other thing. And Israel, a country I know quite well, I spent 4 years there, they've got the highest adult proportion of the adult population vaccinated. But they're having a debate now about whether they need to start having masks worn in public. They push back their opening to international tourists because of the concerns over the Delta variant. So I just make the point that even when our vaccination levels are up, and we must do that, it's important, there are going to need to be probably an ongoing number of restrictions, mask wearing, social distancing, contact tracing, testing, possibly some border restrictions that are going to remain with us for some time. And particularly in light of the fact that we might have not only a Delta variant, but an Echo variant, a Foxtrot variant, a Gulf variant, any number of other successive variants that might come down the pipeline at us.
It's such a depressing thought, isn't it, that there's variants we haven't even had yet that could be even more contagious. And we just have to hope that the vaccines at least give some protection to those variants and prevent the hospitalisations and deaths. Matt Thistlethwaite, how concerned were you by Queensland Premier Anastasia Palaszczuk's comments this week, in effect trashing the AstraZeneca vaccine when it has been something that's been such a lifesaver in the UK? And, as I mentioned earlier in the show, the scientist who invented it, Dame Sarah Gilbert, was applauded at Wimbledon this week.
Well, SHARRI, I think that Anastasia was reflecting the confusion that there is in the Australian community about the veracity of the AstraZeneca vaccine. And that's led to, unfortunately, this vaccine hesitancy.
She shouldn't be confused. She's the Queensland Premier. She has a responsibility to get her facts right. And what she said was wrong. She said that in the UK, people under 40 couldn't have the AstraZeneca vaccine, and that's just factually inaccurate.
She was confused by the Prime Minister's announcement and the fact that he announced it late one evening, didn't consult the premiers about it, and certainly didn't consult their chief medical officers. So the advice that she was getting from the chief medical officer in Queensland was that wasn't the appropriate approach to take, and that's caused confusion. And I think that that's generally reflected in the Australian public at the moment. I'm getting emails from people who are in that age bracket saying, well, should I or shouldn't I be
probably
lining
because
up to
they're
get
so
this?
confused by the Queensland Premier. I think she's confused everybody. But instead of going to you, Dave, on this, I know you want to talk about this, but I just want to...
He should have consulted about that before making the announcement.
Well, it's official. It's always been official medical advice that anyone under 40 could have the AstraZeneca vaccine. That's always been the medical advice.